Hey guys, it's Jen. I hope you guys are doing well. It has been a while and I am sorry that I have just not had the time to really record vlogs, but I'm going to quickly catch you guys up. I have less than a month to go for my Surge 2. I am so excited. I think I mentioned this before in exam 2. I got a B on it, and 7 of the questions again that I didn't that I missed the points on was because I didn't go with my gut instinct. So like when you have the 4 multiple choice answers, there's 2 that are just like you can kind of quickly eliminate those, and then there's 1 with a distractor in it, and then there's the correct answer. So for the 7 of those questions that I got incorrect, I just didn't see the distractor, and I knew both of them had valid points. So anyways, for exam 3, my stress level was less. You know, I prepared well with my classmates, and again, I listened to a lecture. You know, I will read my notes. I'll sit with my study group and just kind of go through it. And I'll talk more about that in a few minutes. So yeah, I got an A on it, and I'm just super excited. It's making me feel better that my exam grade point average is increasing, so that's great. Let's see. Last week I was able to insert a Foley on a male patient, and I also was able to manually bag the patient while we were transporting him to get a CT scan. So that was kind of exciting. Let's see, regarding codes. Oh, so on other of the hospitals that my classmates are at, apparently there's just been, everyone has had kind of some type of participation in a code, whether they've just witnessed someone pass or they were doing CPR. So at this point, yes, things are things are getting real. It's like I'm looking back, and I have some friends in the foundations course, and it's the beginning of it, but this class definitely makes you feel like a nurse. You're there, you are part of the care team, and it's just I would say it's probably the hardest class for me so far because I had other things going on, but I really am doing a lot better, and I'm just grateful that things have shifted from week 1 and exam 1, and I'm just super excited to continue and finish this class strong. So anyways, I have a paper due, I have exam 4, I have a final exam, and then I have an ATI proctored exam to complete, and that, oh, and then simulation 4, and that's it. So 5 things. I am super excited. Let's see. Oh, I also joined my student government association at my college, and I'm acting as historian. So it's interesting that although my life is crazy, I just add more, but I'm enjoying it. Today we had a conference, and I was able to sit in a social media kind of lecture, and I got a lot out of it, so I hope that I can use that for my historian position at SJA, as well as for this iFitNurse blog, just so I can interact more with you guys and make it enjoyable to being part of my journey. Let's see. Okay, the Erin Condren gift card. So I did put up a picture. I asked you guys to share your favorite quotes. Look at my Instagram. It's up there. Only a few people actually applied, so I kind of didn't want to choose a winner yet because I felt like there's more of you guys who would benefit from having an Erin Condren gift card. So go check out my Instagram. If you don't, tweet me, or you can send me a Facebook message or something, and then I'll give you the same guidelines and see if we can kind of get you guys involved. And I'll try to pick a winner. Hopefully I'll have a little more submissions, and I'll pick a winner this weekend. So keep your eyes out for that. And let's see. Okay, let's talk about this whole weight loss. So a long time ago, I told you guys that I was trying to just work out more, especially during nursing school. So someone had asked, is it really not possible to work out? So it is possible. I've been managing to get like at least 45 minutes to an hour workout almost every day. This past week, it's been a little rough, but it is possible. So another thing was before my exam 3, I went and took a yoga class for an hour, and I went home, just read my notes once, and went to bed. And so like normally I'm like hyperventilating, I'm reading everything, I'm doing practice questions. So like I think the fact that I went to yoga cleared my mind. I felt good. I took a bath and read my notes. I went into this exam feeling less stressed and more confident. So I am hoping I can do that. I am moving, which is why another reason why I have not been able to keep up with you guys. So I'm trying to clear up my study, I mean the whole house really. But I did go to a yoga studio, and I was looking for a yoga studio in my new neighborhood, and I found one, and I'm super excited. So I hope that I can keep you guys updated in my yoga journey. I am working on like a handstand, so if you've seen like a video on Instagram, that's what I'm trying to do right now. I decided to just start working on it with like my forearms, and I'm able now to kind of, you know, pick my legs up and not fall. So anyways, that's that. Oh yeah, my weight loss. So since August I've lost 11 pounds, and I don't know if you guys want to know this, but it's really hard. I'm a snacker. I love chocolate, and like if I had to survive, like I would choose like to snack on candy versus like actual meals. So it's kind of, that's my struggle. And again, I do love working out. So like once I'm working out, I feel fabulous. You know, like I love working out. So that's not the struggle. The struggle is actually just kind of separating myself from my nursing homework or whatever. And feeling that it's okay to step away from that and not, you know, to do some workouts, to take some me time. And that's what I've been doing. So I've been managing that, and I'm excited about that. And let's see what else is here. I think I have updated you guys on everything. So we have Thanksgiving break. I did put on Facebook, if you guys have questions, anything that I can help, just let me know. So I'm probably going to take that time to kind of catch up and give you guys more content, more vlogs. And I'm not sure if you guys want like how-tos, or if you have like specific areas in your classes that I may have learned, especially like foundations or those that are doing like pre-nursing school work. Let me know. Maybe I can sit down and kind of, you know, show you my thought process. Oh yeah, so I missed like 3 questions on my last exam, and one of the questions, and I want to explain this to you guys. One of the questions we were learning about the flu, and one of the complications of the flu is developing pneumonia. So I would go, and I'm sitting there with my class, with my study group, and I'm like, okay, so what's the #1 complication of someone who has the flu? And they would say pneumonia, and that's it. So complication of having the flu, pneumonia. So the questions I would say, okay, these are things that how I'm kind of like talking to them, and what I'm trying to think of to make sure that I understand both content. So okay, what's the flu? How do you get the flu? Can you share it? Can you not? What are medications that you can take if you have the flu? What can't you take? Who should take flu vaccines? When should you get it? Is it yearly? Is it every few years? So that kind of gives me a good background on the flu. Then we go into pneumonia, and we do the same exact questions. You know, how is it? How does it progress? All those questions that I just answered. So then if the teacher explains like a certain scenario where a patient came in and had pneumonia, and there's some type of question, I'll recall that. But one of the questions, and I knew that the complication of having a flu, or what can arise if not treated, is developing pneumonia, and I knew that. I knew what it was in the lungs, I knew it all. Then in the exam, I don't know what it was, but nowhere in my thought process came, if someone has bilateral crackles in their lungs who was diagnosed with the flu, what would be the assessment that you would most prioritize to, you know, further assess, etc. And it happened to be the crackles, because it's pointing at the flu. The person had the flu, and it developed to having pneumonia. So I know that the complication that could arise pneumonia from the flu, but I did not, like, it did not jump at me how you assess it. What are the findings that you would see when you assess the person that would mean that the person is developing pneumonia? So I say all that to say, whenever you're talking about any of the disease processes or anything like that, make sure you always know how you assess it, what tools you may need, any lab values that may indicate that certain, you know, organ dysfunction or whatever. So yeah, just always make sure if you're learning whatever topic, how does the nurse figure that out? How does the nurse assess to see if that is pneumonia or could be developing pneumonia, or if it's a worse, you know? So I was just really bummed because I knew the background, which is, you know, flu, pneumonia, the correlation, how it can lead to that. And I just did not, I missed the whole assessment part, and I missed that question. But whatever, I hope you guys got something out of that. I'll keep this kind of short because I have to go to church. But hope you guys had a good one. Again, if you have any questions, leave in the comments below. Hello to new subscribers. I promise I'm a little more interactive. It's just been a crazy semester. Again, if you have any questions or anything that I could probably break down, I could do a video on, let me know. And I think that's it. Don't forget to comment, like, and subscribe, and share the videos. Bye!